Hi, my name is Marcus Henry. The topic I decided to present on is preventing child abuse and neglect. Child abuse is a serious problem that needs to be addressed in the United States. Data from 2007 indicate that approximately 1.86 million families were investigated for child abuse, and out of those 1.86 million families, 720,000 children were determined to have suffered from abuse by a parent. Notably, more than 1,500 children died due to childhood abuse as well in 2007. Childhood abuse entails physical abuse. Physical abuse occurs when pain is inflicted on a child, where it was intentional or not. Sexual abuse happens when a sexual act that would also include pornography or prostitution. Emotional abuse is described as an action that could cause behavioral, emotional, or mental disorders. And neglect is failing to meet the child's basic needs in the area of physical, emotional, and education. According to behavioral research, abused children experience developmental difficulties and also attachment issues. The program I created, I titled United Families. It was created as a child abuse prevention program that's focused on helping parents learn new parenting skills to prevent abuse on their child and to help develop positive interactions with their children. United Families is available to parents and caregivers who are experiencing a difficult time providing parental care for their children. With this program, there are parent training referrals, which come from the schools, community agencies, pediatricians, and other providers that are working with the family. In efforts to prevent child abuse, parents will benefit from receiving intervention services such as home visiting, mental health, and substance abuse treatment. This program was utilized to help implement visitations between the parents and the children. That will be the first section I will talk about. The home visitation program is a highly recommended service that has been successful in preventing child abuse according to research. It was found that home visitations have been a successful intervention and have helped parents develop a stronger bond and to learn about their children's needs. In looking at the data between families who participated in a home visitation program, there was a 38.9% overall reduction of child abuse incidents. In order to help prevent child abuse, this program was implemented for parents who are at risk for abusing their child. The home visitation service model the home visitation service has been modeled after Healthy Families America module, which has been implemented in 39 states throughout the United States. The Healthy Family America program has been effective in reducing the rates of child abuse throughout the United States. The program that I created is very similar to that. It is an in-home intervention that works closely with parents to help promote healthy family interactions. So I feel that by engaging parents in different parent-child scenarios, parents will learn appropriate ways to respond. For instance, a parent who is dealing with a child with behavioral issues, maybe a child that's defiant, maybe a child that's also, fights a lot with the siblings or has a difficult time adjusting after school or just when it's time to go to bed. this program will be healthy to be able to help the parents go through those scenarios to figure out what is the best way to help the child to make sure they respond in an appropriate and respectful way, and also to ensure that the parents are modeling appropriate interactions and responses to their child's behaviors. If a parent is reacting negatively, aggressive, with that we can see that kids, learn that behavior. Then they go on to model that behavior in their lives and possibly in school. In order to work through these scenarios, the families are provided a case manager and a parent aide. The case manager is able to provide the family with any resources they may need. They may need bus passes. They may need assistance with their utilities. They may need a food box, or they may need a referral or help getting insurance or any other type of community service. They may need vocational training as well. So with this program, the home visits are made 3 times per week for the first month to assess the family and to ensure that everything is going well. If there are no safety barriers, after the first month, visitations can be reduced to once per week or even twice per week, depending on the needs of the family on how they're adjusting in the home. During the weekly visitations, the team can assist the family, like I said, with community resources, transportation, food, clothing, educational and vocational training, and also healthcare referrals. The United Families component serves as a positive support for parents to help improve the parent-child interactions and to help educate parents about developmental milestones as well. The purpose of this team is to develop a strong relationship with the parents and to also serve as a mentor for the parents. The case manager and parent aide will demonstrate appropriate responses and model the behaviors that are expected out of the parents. For instance, home visitors are available to provide support to the parents in crises as well. The program focuses on the strengths of the family and not the problems. Although the problems are addressed, the emphasis is to focus on what the family does do right and then to build from that foundation onto their needs so that the family is, encouraged that to do better and that they feel that they are making progress. The 4 goals of the United Families program that I've created is, the first one is to work towards preventing child abuse. The second goal is to help improve parent-child relationships. And the third goal is to help educate parents on the development and to improve the parents' well-being. The second component of the program addresses mental health treatment as needed in the home. As we know, parenting a child can be a difficult task, especially if a parent is suffering from an untreated mental health diagnosis. As a result, negative emotions such as frustration, anger, and stress can increase the likelihood of childhood abuse. And so with that, if you add a child into the home who is having behavioral problems or is colicky or just very difficult for the parent to deal with due to the parent's personal struggles, this can lead to child abuse, and that's not what we want. So with this piece of the program, mental health treatment has been the most effective intervention in reducing child abuse, according to research. A majority of the mental health programs addressing child abuse prevention primarily deal with individuals diagnosed with major depressive disorder, schizophrenia, and related disorders, bipolar disorder, and personality disorder. It was found that depression and anxiety have had the highest correlation of abuse. Nicholson in 2007 found that parents with mental illnesses tend to do better with various treatment approaches rather than utilizing one approach. The parent mental health programs that have been researched examine other mothers, either mothers only or mothers and fathers. This program has been designed to work with the mother and the father if possible. As we know, there are some instances where parents may be divorced or separated, or there may be a single mother that is the sole provider for the child. So this program is hopefully going to be able to engage both parents to make sure that the child has that consistency. The mental health program in this agency consists of also case management services that will provide interventions in the following ways, such as emotional support and problem solving. The case manager can submit referrals and access to and coordination of multiple services. And the third, crisis management. Families will have access to a crisis line that can be utilized 24 hours a day. United Families mental health program consists of psychotherapy that can help parents reduce stress. All parents that come into the program will complete mental health intakes to determine if they're in need of psychotropic medications and to determine the counseling needs of the family. The parents may need to engage in individual counseling and also in parental counseling or family counseling to make sure that the family is progressing. Counseling is effective in helping parents deal with internal issues that can help reduce their stress levels. If a parent needs psychotropic medications, that can also help with the parent's well-being, irritability, or their mental state. Parents who become involved with child protective services may be suffering from an underlying condition such as a mental health or substance abuse issue that has not been treated. To make things more complex, a parent with a mental health diagnoses and also substance abuse diagnoses can result in a co-occurring mental health and substance abuse disorder. Co-occurring disorders are common among parents involved in CPS. A parent that lacks appropriate coping skills to help deal with their stress, they may turn to alcohol, marijuana, methamphetamine, some sort of drug to help them cope with what's going on in their life. And we know that's not healthy, and it's not appropriate for parents to be doing that. This program has a substance abuse component that works towards helping parents develop or maintain sobriety. Parenting a child requires that a parent be alert and responsive to the needs of the child. Children of parents who use drugs are at a greater risk for being involved with CPS. In particular, prenatal exposure to alcohol can result in a child suffering from heart defects, hearing and vision problems, facial deformities, small head circumference, decreased height and weight, and increased risk of stillbirth, miscarriage, and infant mortality. A child that is born substance exposed to drugs, with these developmental disorders that a child is born with, it can also lead to more difficulty in parenting that child. That can also lead to the parent being frustrated and not having the patience to be able to deal with a child that has special needs. So for pregnant mothers, United Families has implemented Florida's Perinatal 20 outpatient programs for high-risk infants and their parents. This program targets women who are at risk for abusing their children due to alcohol or drug addictions. To be successful, it is important that interventions begin early. The Perinatal 20 also provides case management, individual counseling, and group counseling for mothers. This program will also assist parents with childcare to ensure that they can attend these outpatient treatment groups. Childcare can be a barrier sometimes for parents, to not be able to attend groups. So we want to make sure that the parents have this, have childcare accessible to make sure that they can make progress in their needs. In the event that a parent needs inpatient treatment, it has been found that a written agreement between the parent and if there's a child care agency involved or our program, it can be helpful in increasing their success rate. So the inpatient program that we have is modeled after Project Together. During the first 2 years of Project Together, 90% of parents in the program were successful and reported improved sobriety, parenting skills, and were less stressed. Upon successful completion of a substance abuse treatment, it is also recommended that a parent engage in 12-step meetings to ensure sobriety, because addiction does not end after completing treatment. Addiction is a lifelong process that a parent will need to continue to address. The outlined substance abuse treatment options will serve as a positive support to help stabilize parents so that they can engage in healthy parenting practices. So to sum up the program, it is evident that, according to statistics, that child abuse is a national problem that requires preventative measures. Research has indicated that the lifetime economic burden of child abuse costs the United States $124 billion annually when factoring in criminal proceedings and the justice system. Furthermore, abused children may suffer physically, psychologically, or behaviorally. Parents who become involved with CPS may be suffering from an underlying condition such as mental health or substance abuse, and the co-occurring with the mental health and substance abuse problems can magnify the stresses in the family and make parenting more difficult. So to help United Families become a successful intervention, we will need to educate schools, child welfare agencies and providers, lawyers, judges, and primary care physicians so that they are aware of the program and that they can refer clients if they're worried about the risk of child abuse. So the parent training programs have been found to be successful in reducing child abuse when they address parenting skills through home visits, mental health, and substance abuse services. The United Families program is modeled after a few successful evidence-based programs throughout the United States. Equally important, United Families staff is able to work with English and Spanish-speaking clients. If we do have clients that speak a different language, we will be able to secure an interpreter so that we can help that family. Ultimately, it is our responsibility as society to take the necessary steps to help ensure all children are raised in a safe, loving, and abuse-free home. No child needs to grow up abused. Childhood abuse results in long-term, detrimental effects, which can lead to an intergenerational transmission. So where a child is abused, the child grows up, has his family, he or she abuses their children, and it's just a cycle that continues to go on and on because that's what the child was taught as, that's what parenting is like. So we need to break that cycle, have children learn, what positive parenting is and healthy relationships. So my question to you is, what do you feel it will take to reduce childhood abuse? Do you feel it's a funding issue, a matter of public education, or just having more community support? And also, I'm curious as to, do you feel that there's been an increase in childhood abuse since maybe the 80s, 70s or 80s due to possibly the 80s and 90s due to the increase of different drugs that are available, mental health disorders. It seems like there's more of an intervention to help address those. So my question is, do you feel that there's an increase of abuse since the 80s? Thank you for listening to my presentation. I look forward to answering your questions and interacting with you. Thank you.